welcome. If you're a phlebotomy student getting ready for your NHA CPT exam, then you are in exactly the right place. We're about to break down the key terminology from Chapter 6 of your textbook, and we're going to focus on exactly what you need to know to ace that exam and really shine on the job. So let's just dive right in with why this is so unbelievably important. This NHA exam alert says it all. Misunderstanding a medical term isn't just about getting a question wrong on your test. In the real world, it can lead to a huge patient safety issue. Honestly, this language is the absolute foundation of your role as a phlebotomist. All right, so here's our game plan. We'll kick things off with why this matters so much. Then we'll get into the fun part, how to actually decode these terms. We'll also tackle some tricky grammar rules, get a handle on the language of compliance, master the shorthand you'll see every day, and wrap up with the super critical do not use list. Okay, first up, why is terminology your first line of defense? Well, think of it as the official language of healthcare. When we use it correctly, we're making sure every single thing we do is precise, it's understood by everyone, and most importantly, it's safe for our patients. You know, every prefix, every suffix, and every root word you learn is like adding another layer of armor against making a mistake. In fact, NACLS, that's the agency that accredits your program, sees this as an absolutely essential skill you need right from day one to provide quality care. And this has a direct impact on both your exam and your entire career. On the test, you're going to get hit with scenario questions where you have to interpret an order correctly. But in the clinic, being able to recognize a word root in a split second could be the one thing that prevents a really serious error. It's what separates a good phlebotomist from a great one. So how do we get good at this? Well, the secret is to stop seeing these big, complicated medical terms as single words. Instead, think of them like puzzles, made up of smaller, easy-to-understand pieces. Once you learn the pieces, you can figure out pretty much anything. Here is your simple 3-step process for decoding any term you run into, whether it's on the exam or a patient's requisition. Now, it might sound a little backward, but you always start at the end with the suffix. That tells you what's happening. Then you jump to the beginning for the prefix, which adds a little more detail. And finally, you find the root in the middle. That's the main subject. And this is where the real power is. You don't have to memorize a million words. By just learning a handful of these really common roots, you can crack the code for hundreds of medical terms. Like, once you know phleb means vein, a word like phlebotomy suddenly makes perfect sense, right? Prefixes give you that crucial context. They're like little signposts. A perfect example and a classic exam trap is mixing up hyper and hypo. One means high, the other means low. If you get those switched up, you're looking at a completely different clinical situation. It's a huge deal. It's the same story with suffixes. They tell you what's actually going on. The NHA specifically warns that just ignoring suffixes is a major league mistake. If you confuse itis for inflammation with anemia, a blood condition, you've completely misunderstood what the doctor ordered. All right, let's wade into some of the trickier waters now. These are the areas that pop up on exams all the time, where the normal rules of English don't quite apply, and you have to be super precise. You have got to be careful with plurals. This might seem like a tiny grammar thing, but on a lab report, reading bacterium, just one, when the paper says bacteria, a whole bunch of them, completely changes the story about a patient's infection. And this right here is a perfect example of why context is everything. Look at phlebotomy and phlebitis. They both share the root phleb for vein. But one tiny change to the suffix takes you from talking about our everyday procedure to talking about a serious medical problem. You have to look at the whole word, always. Okay, let's switch gears and dive into the abbreviations you'll see in all the rulebooks and procedures. These aren't just random letters, they represent the rules we all have to follow to keep ourselves and our patients safe. So you're faced with a situation. Whose rules do you follow? This is a classic type of exam question. It's all about knowing which agency is in charge of which rule. Let's break down the main players you gotta know. Here's the simple way to keep them straight. Think of OSHA as the police. They enforce the safety laws, like for bloodborne pathogens. CLSI is like the author of the instruction manual. They create the best practice standards for how to do procedures. And NACLS, they're like the school board, making sure your education is up to snuff. Knowing who does what is key for those compliance questions. Okay, we've covered the rule makers. Now let's get into the clinical shorthand you are going to see every single day on requisitions. These are the quick commands that tell you what to do and how fast to do it. Getting any of these wrong can cause big problems. STAT means you drop what you're doing and go now. NPO or FBS means you absolutely have to check if the patient has been fasting, otherwise the test is useless. And if you see QNS, it means you didn't get enough blood, and you'll probably have to stick the patient again, which nobody wants. And finally, we've arrived at what might be the single most important topic we'll cover, the most dangerous abbreviations in all of healthcare. These are terms that are officially banned because they can cause catastrophic mistakes. This is not optional, you guys. This is mandatory knowledge. These abbreviations are forbidden for one simple reason. They have been directly linked to serious and sometimes even fatal patient harm. You have to know them, you have to spot them, and you can never, ever use them. Always, always write out the full word. And just look at this. This shows you exactly how high the stakes are. A missing 0 at the beginning can make 0.5 look like 5. An extra 0 at the end can make 5.0 look like 50. We're talking about a potential 10-fold overdose because of one little dot. So remember the rule. Always lead, never trail. A leading 0 before the decimal, but never a trailing one after. And I want you to remember this. This is your job. This is your power. You are that final safety checkpoint. When a requisition lands in your hand, it's on you to spot these dangerous terms and get them clarified before you ever touch that patient. You are their advocate. So as we wrap this up, I want to leave you with a question to think about. After everything we've just covered, from word roots to that do not use list, what's one specific mistake you feel ready to catch and prevent? Taking this knowledge and using it right away, that's the real key to making sure every order is right and every single one of your patients is safe.